A comfortable mattress, a darkened room, and 8 hours on the clock feel like the recipe for perfect rest. Yet after age 70, the body changes so dramatically that even small bedtime routines can turn into quiet threats, straining the heart, starving the brain of oxygen, or setting the stage for a catastrophic fall. Many older adults wake each morning unaware that their habits overnight came dangerously close to catastrophe. The good news, every one of these risks can be reduced or eliminated by reshaping the hours that lead up to lights out. Below are 10 deceptively harmless behaviors that scientists and geriatric physicians now link to sudden nighttime deaths. For each one, you'll learn why it matters, how it harms, and the practical fixes that keep sleep the safest part of the day, not the most perilous. Parking a cell phone on the nightstand. Most people keep a phone within arm's reach to use as an alarm, scroll headlines, or play music. But two hidden dangers ride shotgun with that convenience: blue light exposure. Notifications and screen checks, even brief glances, bathe the eyes in short wavelength light that shuts down melatonin production. Without melatonin, deep slow wave, sleep shortens, blood pressure stays higher, nighttime heart rate never fully recovers. Over months, this shallow sleep correlates with hypertension, arrhythmia, and memory decline. Electromagnetic stew. While definitive human data are still emerging, several lab studies show that long-term exposure to a phone's radio frequency waves increases oxidative stress in neurons and slightly alters heart rate variability, two markers already compromised. In older adults, fix it tonight. Charge the phone in another room or place it on airplane mode. Use a battery-powered alarm clock. 30 screen-free minutes before bedtime allow melatonin to surge naturally and prime the brain for restorative sleep. Standing up too fast. The urge to hit the bathroom at 2 a.m. feels harmless until dizziness blurs vision and gravity wins. That spin is orthostatic hypotension. Blood pressure plunges because vessels react more slowly after decades of stiffening. A single misstep on the way to the toilet can shatter a hip, trigger internal bleeding, or cause a subdural hematoma. That never fully heals. Fix it tonight. Keep a flashlight or motion-activated nightlight by the bed. When nature calls, first roll to your side, dangle your legs and count to 10. Stand only when you feel steady. Non-slip slippers and grab bars along the route cut risk even further. Swallowing one little pill without medical oversight, sedative, sleep aids, nighttime painkillers, and certain blood pressure tablets share a dark side. They suppress respiration or overshoot blood pressure targets while you're unconscious. Benzodiazepines, diazepam, clonazepam, alprazolam, can prolong breathing pauses. Long-acting opioids slow the respiratory drive. Some alpha blockers and ACE inhibitors drop systolic pressure so low that brain perfusion crashes. Next morning grogginess is not benign. It signals that drug levels remained dangerously high all night. Fix it tonight. Ask your physician for a sunrise review of every pill taken after 6 p.m. Many antihypertensives work just as well when swallowed at breakfast. For insomnia, trial non-drug tools first. 20 minutes of evening sunlight, meditation, magnesium-rich foods, and consistent wake-up times. Ignoring the midnight urge to urinate, holding urine because the bed feels warm, or because the hallway feels treacherous, creates back pressure in the bladder. In younger adults, that's uncomfortable. In seniors, it can force bacteria upward toward the kidneys, provoke infections, and in extreme cases, cause reflux that scars delicate renal tissue. Add disturbed sleep from the discomfort, and you have a cocktail that inflames blood vessels and elevates nighttime blood pressure. Fix it tonight. Install a soft nightlight and clear floor clutter so the trip is quick and safe. Front load. Hydration during daytime hours and taper liquids 2 hours before retiring. Report frequent nocturnal urges to a clinician. Prostate enlargement, diabetes, or overactive bladder disorders are treatable once identified. Cranking up the thermostat or sealing the room. A cozy 78-degree craft bedroom forces the body to fight heat when it should be cooling for slow-wave sleep. That little extra warmth elevates heart rate, thickens blood through mild dehydration, and can precipitate clot formation in susceptible vessels. Poor ventilation compounds the strain by trapping carbon dioxide, making breathing laborious in anyone with asthma, COPD, or heart failure. Fix it tonight. Aim for 65-72 degrees F, 18 to 22 degrees C, with light cotton bedding. Crack a window or run a quiet fan for airflow. If you shiver easily, layer a throw blanket at your feet rather than overheating the entire room. Eating a heavy, fat-rich dinner. Within 3 hours of bed digestion, diverts blood to the gut, spikes triglycerides, and raises core temperature. All at a time, your heart expects a restful lull. In seniors, that mismatch can produce nocturnal angina, silent heart attacks, or severe acid reflux that spills into the airway and triggers aspiration pneumonia. Fix it tonight. Finish big meals by 7 p.m. Choose lean protein, steamed vegetables, and whole grain sides. If true hunger strikes later, stick to a small apple, a handful of almonds or yogurt, snacks that stabilize blood sugar without overloading digestion. Leaving a lamp, TV, or LED display, glowing even a dime-sized indicator. Light can shave melatonin secretion by 50% in light-sensitive older retinas. Epidemiological studies now link light at night to higher rates of obesity, hypertension, insulin resistance, and certain hormone-related cancers. Cognitive decline also accelerates when deep sleep cycles are fragmented by illumination. Fix it tonight. Remove digital clocks with blue LEDs, cover power lights with opaque tape, and shut the television off fully. If darkness breeds anxiety, opt for an amber nightlight under 5 lux placed near the floor, low enough to preserve melatonin, bright enough to navigate safely. Sleeping flat on the back. When apnea or reflux is present, supine sleep lets gravity drag the tongue and soft palate against the airway, magnifying obstructive sleep apnea. Oxygen saturation can drop below 80% dozens of times each hour, hammering the heart and starving the brain. Meanwhile, acid in a full stomach flows uphill into the esophagus, often silently, inflaming tissue and provoking microaspiration into the lungs. Fix it tonight. Train yourself to sleep on the left side. Tuck a pillow behind your back or use a body pillow to prevent rollover. If apnea is diagnosed, use prescribed CPAP or dental positioning devices without exception. Elevate the head of the bed 4 to 6 inches if reflux persists. Guzzling a big glass of water right before lights out hydration is vital, but timing matters. A late-night quart of water sets up a vicious cycle. Repeated bathroom trips, dangerous orthostatic hypertension, and fractured sleep that raises morning cortisol. In patients with heart failure, excess fluid overnight can worsen pulmonary congestion or elevate blood pressure to risky peaks. Fix it tonight. Drink generously between breakfast and dinner. After 8 p.m., limit yourself to small sips to quench dry mouth. Keep a sealed bottle bedside for emergencies, but plan to consume most fluids earlier in the day. Shacks. Dismissing loud snoring and nighttime choking as just age habitual snoring, pauses in breathing, and thrashing wake-ups are red flag symptoms of obstructive sleep apnea. Untreated OSA quintuples stroke risk, triples atrial fibrillation incidence, and speeds memory decline. Because episodes occur while unconscious, many seniors remain oblivious until a bed partner speaks up or until a cardiovascular catastrophe strikes. Fix it tonight. Record a short overnight audio clip with a phone placed across the room to avoid radiation proximity. If snorts, gasps, or prolonged silences appear, share the evidence with a physician. A home sleep study or in-lab polysomnography can confirm the diagnosis, and modern CPAP machines are quieter and more comfortable than ever. Pulling it all together. Healthy sleep after 70 is a fragile, life-saving equation. Protecting it requires vigilance long before the first yawn. Start a 30-minute tech curfew to let melatonin rise. Keep dinner light and early. Nix late caffeine and alcohol. Set the thermostat for cool comfort and ventilate gently. Stage the bedroom as foolproof territory. Soft light, clear path, sturdy slippers. Choose a heart-friendly sleep position and treat breathing disorders aggressively. Review Every medication with a professional. Question nighttime dosing when alternatives exist. None of these adjustments demand heroic willpower. They are small levers that yield enormous returns: steadier blood pressure, deeper brain repair, stronger immunity, and mornings that begin without bruises, brain fog, or unexplained fatigue. Aging with dignity is not merely about adding years. It is about adding good years. Years lived in your own home under your own power, with your memories intact and your confidence unshaken. The night can either erode that future or fortify it. Tonight, let it fortify. Pull the phone from the nightstand, dim the lights, pick the left side posture and step slowly when nature calls. Your heart, brain and bones will thank you every dawn that follows.